Welcome to this short presentation on global perspectives on newborn care. My name is Jenna Soul. I'm a paediatric trainee on the neonatal unit. And I'd like for us to think today briefly a little bit outside the neonatal unit at the Evelina, and indeed newborn and neonatal care in the UK generally, and think a little bit more about global perspectives and what it looks like for neonatal care across the world. We'll start off by looking at some of the global inequalities that exist in neonatal mortality rates between different countries in the world. We'll go on to look at some of the public health and policies that have been implemented to try and reduce these inequalities and improve newborn care. And then look ahead to the future and what needs to change. In this chart here, you can see global causes of under 5 mortality. The areas in orange, the segments in orange, reflect causes of death amongst children between 1 month up until the age of 5 years. And those in blue reflect causes of death amongst newborns up until an age of 28 days. And from this, it's really apparent that the neonatal period up until 28 days of life is very high risk for babies. In fact, indeed, you can see that 3 of the top 5 causes of under 5 mortality occur in newborns, and that is prematurity, intrapartum complications, predominantly birth asphyxia, and also neonatal sepsis. So it's really striking to see that babies who are born too soon, too small, or babies who are born unwell unexpectedly are at high risk of death and disability wherever they're born. But what I'd like to persuade us of today is that the location that the baby is born in has a huge impact in terms of their outcome, whether that means whether they survive or not, or their long-term risk of disability. On this chart, we can see some of the rates of neonatal mortality in different countries and different regions across the world. Mortality rate is measured per 1,000 live births, and you can see a global average of just over 17 deaths per 1,000 live births across the world, but with very significant variation in different regions, different continents of the world, and indeed in different countries. Japan has one of the very lowest neonatal mortality rates in the world at just 0.9 per 1,000 live births, whereas other countries, babies born in other countries are at significantly greater risk of dying in the neonatal period, with rates up to 42 to 44 per 1,000 live births in countries such as South Sudan and Central African Republic. The UK rate is about 2.8 per 1,000 as of this data in 2018. And on this chart here, you can see some of those rates plotted in a graph form, and then in due course we'll see the trend in survival for newborns born in different countries over the course of time. On this chart here, the x-axis is neonatal mortality rate, the y-axis is income, and that's measured in GDP per capita. And the bubbles here reflect countries, one bubble per country with a larger bubble for a country with a larger population, and vice versa. And you can see, not unexpectedly from this graph, that there's a general correlation between improved neonatal mortality rates and countries with a high income, as you might expect. Although that correlation is not the case in every situation, it's interesting to see some of those anomalies. If we look at some of the countries reflected on this graph, you can see India, China, the US, Nigeria, some of the larger countries. You can see us, the UK, amidst a cluster of other European countries in yellow, nearer the right-hand side of the graph. Here is Japan, who we've mentioned has one of the lowest neonatal mortality rates in the whole world. And this is Central African Republic with a rate of 44 deaths per 1,000 live births. It's also interesting to look at which countries are performing perhaps better or less well than might be expected for their income level. So, for example, Cuba has a relatively low neonatal mortality rate compared to what might be anticipated. And of course, you can look in the opposite direction to see which countries have higher levels than you might otherwise have anticipated. I'd really encourage you to have a look at this website and have a play with these graphs. And this is gapminder.org. and gives data not just on newborn survival, neonatal mortality, but on many other health indices, and also shows social and economic indices as well. And you can select particular countries that you're interested in and filter out other ones if you're interested in looking at a particular region or a particular country. And what we can see also from this graph is the change in neonatal mortality rates over time, over the last 50, 60 years or so. The data starts in the 1950s, and you can see the bubbles appear, and as time goes on, a general trend right across the world in improving neonatal mortality rates as time goes on. And this ends in 2015, which is the latest data available via this website. It's particularly interesting to focus in on some of those regions and some of those countries and see how things have improved very dramatically. So, for example, if we go back, focus in perhaps on some of the Asian countries, some of the larger pink bubbles, and watch them as time goes on, as you can see the dramatic improvements in newborn mortality rates in the last 20 years, particularly for countries like China and India. And we can group neonatal care by countries' income levels, make some generalizations. High-income countries like our own have access to full intensive care for babies born prematurely or babies born unexpectedly unwell at term. Middle-income countries also have access to neonatal care, but the risk for these babies is slightly higher in terms of their risk of mortality, but also there's an increased risk of long-term disability in babies born prematurely in countries with lower levels of resources available for neonatal care. And in low-income countries, the challenge is still very much one of survival, particularly for babies born outside of a facility or in a setting where equipment or staffing or cot access may well be limited. And of course, these are big generalizations. Within one country, there may be a significant variety in the levels of care available for babies, and there will be differences in the accessibility and the affordability of that care for individuals and for their families. But it's interesting to group different levels of resources available by income threshold for the country. This poster here is from the WHO and from UNICEF, who state that every year 2.6 million babies die in the neonatal period from the causes that we've already identified: prematurity, complications during birth, and severe infections. But the thinking is that around about 3/4 of these deaths can be prevented with good, high-quality neonatal care. And the WHO and UNICEF have outlined a number of public health interventions, guidelines, and policies to try and improve newborn care and to reduce the coverage gap and the inequalities that exist in terms of the outcome for a baby born in different parts of the world. Back in 2014, The Lancet published the Every Newborn series, which you can see the publication on the left-hand side here. And on the back of that, very shortly, an action plan called Every Newborn Action Plan was published on the back of the data that was made available from that series to improve awareness of the inequalities that exist in neonatal care across the world, and to develop an action plan to reduce the gap in outcomes for babies born in different places. More recently, in 2018, Survive and Thrive was published, and this maps out the progress that's been made to date and the progress that's needed in order to achieve the goals that have been outlined in these publications. One of the key goals is that by 2030, all countries will reach a target neonatal mortality rate of less than 12 deaths per 1,000 live births and continue to reduce death and disability. And this is in keeping with the Sustainable Development Goal 3.2. You'll remember from some of the data we presented at the beginning of the presentation that the global average is currently just over 17 deaths per 1,000 live births, but in some countries in particular, the mortality rates are very significantly higher than that. So that's quite a challenging target to reach. This website, countdown2030.org, outlines the progress that's been made to date in reaching that target and the gaps that still exist for many countries to try and achieve them. It's well worth a look. You can have a look on the website and highlight a particular country that you have a particular interest in yourself, and analyse their current mortality rates, the interventions that are in place to improve newborn care in that country, and to see what still needs to be done in order to reach the target rates. And one of the key messages of these publications and these action plans is that the majority of newborn deaths can be prevented with relatively simple, relatively low cost interventions. Things like promoting skin-to-skin contact early after delivery for improved thermoregulation in newborn babies, access to relatively simple medicines like antibiotics, promoting exclusive breastfeeding for babies, and access to clean, well-staffed, well-equipped health facilities with good training for staff and education for parents and their families. Most of these interventions are relatively low cost. It's not about trying to send out lots of ventilators or specialist equipment to low resource settings. It's about putting in place interventions that are context specific and really do make a difference in terms of improving neonatal care. The other factor is that investing in maternal and antenatal care can really improve outcomes for the babies as well. So by improving antenatal care, there's a double gain for reducing both maternal and neonatal mortality. Every newborn action plan groups the different interventions into 3 categories. There's the essential newborn care, which is universal care for all babies born, whatever gestation, and healthy term newborns. Things that we would perhaps take for granted, like thorough drying of the baby, early skin-to-skin contact of the newborn with its mother, delayed cord clamping, universal access to vitamin K, weighing the baby, and careful postnatal follow-up, management of feeding problems, and common neonatal problems such as jaundice and hyperglycemia. Then there's a special newborn care for babies born prematurely or born with some relatively straightforward problems in the early neonatal period. And these include things like detection and management of infections with safe administration of oxygen and antibiotics, detection and management of seizures, safe administration of fluids, kangaroo mother care to improve thermoregulation for preterm babies. And then this last group of intensive newborn care for babies requiring more specialist intervention. There's a real focus on making sure that the essential newborn care is available for all healthy newborn term babies to prevent them from becoming unwell. So in summary, we've had a look at some of the global inequalities that exist in neonatal mortality. We've looked at the Lancet Every Newborn Health series and the policies and interventions that have come off the back of that, and looking ahead to the future and what needs to change to improve global neonatal mortality worldwide, and to ensure that a baby born in different countries of the world have a good chance of survival regardless of the location of their birth. And then lastly, I just wanted to touch on the indirect impact of COVID-19 on maternal and child health. It's very clear that this is very topical, and it's very clear that COVID-19 is already impacting the availability, the accessibility, and the quantity of health services available for pregnant women during the antenatal period, and also for newborns. And sadly, it seems that this will have an adverse impact on maternal and child health for some time in the future, even in the absence of any direct impact of COVID-19 virus infection itself on those groups of people. There's lots of uncertainty in terms of this, of course, at this point in time, but it'll be interesting to see what the outcomes are in light of this new challenge. Thank you very much for listening. Please do drop me an email or get in touch if you've got any questions, and I would encourage you to have a look at some of the resources that we've talked through, and particularly gapminder.org, the website, or the publications available via the World Health Organization website on improving global newborn care. Many thanks.